Hello, those of you who've met me before, you know perfectly well that I'm Jon Wilks, and I'm the Chief Executive of the Institute of Health and Social Care Management. If you've not met me before, well, now you know as well. So everybody is united in this glorious knowledge. Today, big day, first one we've ever done. We're looking at our how-to series, and we're looking at organising your workforce for success. We're going to be looking at this from a combined health and social care perspective. I hope that's okay with everybody. And yeah, it's going to be a kind of a bit of a jaunt through. Some of it's theory, some of it's practical stuff. I'm aiming, given that I've only got an hour, to try to give you some hints and tips to make your process of recruitment, retention, training, workforce planning a little bit more straightforward, and maybe give you some hints and advice about how you might plan and strategize that in the slightly longer term. Okay, as ever, this is designed as an interactive workshop, so please feel free at any stage to ask a question, and periodically I'll ask you questions. It'd be lovely if you just unmute and give me your feedback. That would be very, very helpful. I thought that we might start with this. Anybody got any ideas what this might be?
That's an IKEA bookshelf. It's called Billy.
It's the single most popular IKEA item, apparently. They've actually even now done an instruction book on how to disassemble Billy, because there's so many of these blasted things around the country. Hands up if any of you have assembled a Billy in the past and have it in your house. You see, it's almost ubiquitous. It's Alexa, you've got to sort this out for yourself. Have you got an IKEA nearby you can pop along to? You need to get along. Check the Billies out. They're cheap as chips, and you even get shown how to disassemble them as well. Anybody got any ideas why I might have put this up?
It's definitely got to be to do with have a friend with you or don't do it alone. It's definitely going to be there.
Well, I love that answer, Josh. It wasn't quite what I was looking for. The big
lots
thing
and
is,
lots of components.
Lots and lots of components. So what have you got to be before you start assembling a Billy? You've got to get yourself prepared. You've got to get everything laid out. You've got to kind of figure out the order of assembly and all the rest of it. I'm bang with Josh. If you need somebody with you, it better be a friend rather than a spouse, because if it's a spouse, you're just going to end up knocking chunks out of each other. So I think, yeah, get prepared above all else. And as far as I'm concerned, the number one thing in respect of getting prepared for workforce planning is a bit of honesty with yourself in respect of Gallup's, what I refer to as 12 conditions of success. I am hoping that you can all read this. I am going to send all of these slides to Jade afterwards so that she can send them on to you. But this is just super duper important in the context of workforce readiness and planning. By the way, these 12 questions all underpin the annual NHS staff survey, but they are perfectly applicable in social care environment as well. And the idea is that you would require every single member of your staff to be able to answer yes to every single one of these questions if you are truly prepared to have a high-performing, well-retained, high-performance workforce at your disposal. And just look through all of the things, how many of them are orientated to making the person feel listened to, valued, respected, acknowledged, rewarded, cared about, concerned for. Virtually every single one is to do with the extent to which the person feels that you have an interest in their well-being and development. And the temptation when we start on something to do with, you know, how to do workforce planning and so on, is to go straight into how to do recruitment, how to do retention, how to do exit interviews, how to benchmark yourselves and so on. All perfectly worthy stuff. But really, I would suggest take a step back and you just look at how well prepared you currently are for actually looking after your staff in a helpful and concerned manner from the outset. I've worked with far too many organisations in the past that want to get to the nitty-gritty practical stuff, but when they look at this, they're really struggling. They've got a lot of people who don't remotely feel able to answer yes to many of these questions. If you wanted to be really brave, by the way, well, what do you think you could do? This is one of those interactive moments, by the way. Rachel, what do you reckon? We'd love to hear you, Rach, but you're on mute at present, I'm afraid.
Oh, do you know what? I do that all the time. I just asking perhaps colleagues or perhaps the staff that you line manage, if you meet any of them, like do I recognise my staff? Do I praise anybody for their work? Sort of turn it on its head to see, am I meeting those expectations that I would expect of other people?
Yeah, you could do it even more fundamentally straightforwardly than that. You could just issue those 12 questions to every member of your team and ask them to put their honesty hats on and say, honestly, I would like you can anonymously do it if you like, but I'd just like you to answer each of those 12 questions out of 5. So 0 or 1 would be not at all. 5 would be absolutely full on. Give yourself, therefore, a score out of 60 for every single person that you have. Knock that into an average over all of your people who report to you, and then take it on the chin. If you're a 40 out of 60 kind of a leader or a 20 out of 60 kind of a leader, well, you need to wear the responsibility for that and do something about it. You should be able to see where have you got the gaps and then figure out what you could sensibly do about that. Okay, I just think this is such an important place to start for us if we're serious about workforce planning. Right, let's move along. The second thing I would suggest that you ask of yourself and the people that you are privileged to lead is, what are we trying to achieve? What's the single big goal around which we all build our daily enthusiasm, inspiration and motivation to come to work and give of our very best? And is that sufficiently worthy and attractive that people will get out of bed even on a wet Wednesday morning in February and want to come and give of their very best despite all the circumstances piled up against them wanting to do that? So it's got to stand the test of time. But again, I speak to so many organizations and they've got all sorts of things to do with wait lists or retention or recruitment or money or CQC inspections and so on. But to the average person much lower down the hierarchy, when you say, what are we here to do? They just can't give you any kind of a consistent answer. And that might be a really useful kind of marker for you to put down to say, have I got this properly set up in the first place? Moving along from there, again, an issue that I have is the number of organizations that have got a perfectly clear set of key performance indicators by which they judge the quality, progress of day-to-day, week-to-week, month-to-month, half-year to half-year. And they've got those really clear, and they've probably even got dashboards on people's monitors and so on. So they've got real-time kind of, this is what we're doing, this is how we're performing against these key KPIs. But what they haven't got is a group of inspired people who are really happy to want to come to work on a daily basis and give of their very best. So I would suggest to you, KPIs are all very well and every organization needs them, but in my view, don't let them be overtaken, so don't let them take precedence over how are you trying to inspire your people to come to work on a daily basis and give of their very best. I would suggest to you that KPIs are outcomes based on the extent to which your people feel inspired, trusted, valued, respected, etc., on a daily basis. And if they feel all of those things, do you know what? The KPIs will look after themselves, because people will be wanting to give of their very best. You might want to also, I'm sure we've got one or two fans of Simon Sinek in the room today. Well, you'll be familiar with Simon's graph that starts off like this. And he talks about, when he works with organizations, the extent to which organizations are always preoccupied with performance. What they're not necessarily preoccupied with is the extent to which people either trust their organization or have trust in the people with whom they work. So Simon goes on, you will get the sort of parameters here. So trust increasing that way, performance increasing that way. What kind of people do we want working in our team? Well, I would suggest to you fairly straightforwardly, you all want where the star is. You all want high-performing people who've got high trust in the organisation and can be trusted by you and their peers to actually do the right thing in any given circumstance. What none of us want in any of our teams, forgive me, are the lightning people down here, low trustworthiness, low performing, really, obviously, none of us want those kind of people around. So the big question is, I think, in all of my time managing heaven knows how many people over the years, this is a very, very rare commodity. The star up here, supremely high performance, supremely high trust, a really rare commodity. And when you find them and you're lucky enough to recruit them, look after them like they are your own children, So the big question is, all right, but when I do recruitment or I'm doing appraisals and so on, or I'm looking at the people I already have, where do I go and what do I tolerate in respect of this star? So if I haven't got the star, where do I go? And I would suggest we've all got this mental conundrum of, do we rather have high performing people, but perhaps on the chart here, lower trustworthiness, or would we rather maintain trust and we're prepared to accept a lower ability in terms of their performance? What do you all reckon? Yes, go on, Lisa.
I think it depends a little bit on your output, your departmental output. I've seen a really good piece of research on American Marines where they value trust above performance. So they would definitely take the trust and they will take a little bit less in performance, but then you potentially relying on your buddy to save your life. And it's that really innate trust that you have got to 100% trust them. The performance they can work on, they can drill, etc.
They can learn, they can be skilled up. Yeah,
in that environment, trust is definitely up there. But then the more analytical, the safer environment with a bit more space and time to address things, then potentially you want performance because you need the analytics, you need the deliverables. So I think it depends on the type of environment you're in. But the more people focused, then I think the trust has got to be up there.
Okay, what do the rest of us think? Lisa's been brave enough to go first and give her opinion. What do the rest of you think? So Lisa basically says it depends. What does anybody else think? Go on, Julie. Yeah, go for it.
I prefer higher trust. I work in an acute trust, but I would still, having line managed quite a lot of people, I would take trust. It's not just trustworthiness, not just in themselves, but they trust within the system and that they're sort of fully engaged, and definitely over performance, because you'll have somebody else with potentially within the team that can pick up the performance. But if you get that trustworthiness, I think that's absolutely invaluable in a team environment anyway. If you may be in a very analytical job, maybe, but I think even with I'm deputy head of Oxford, I still would take trustworthiness over performance. But that's just, maybe that says something about me. I don't know. Maybe that's a personal
If
trait.
I could back that, if I might be permitted to back that up as well, Julie, just something to think about is if somebody feels that what they're being asked to do is outside of their skill level, the trustworthy person says, I don't feel able to do that. And actually, I might do harm if I were to do that. Whereas the untrustworthy person might be more tempted to just try to wing it and then cover up any error or mistake that might have been made. And I'm not kind of painting that as a catch-all. I'm just giving it as a sort of an example, backing up Julie's point, really. Well, I've seen, Lisa, I've seen that same piece of research, and it's Simon Sinek that did it with the US Navy SEALs. And he says, trust every day. They would much rather people work with them who are not necessarily the most technically competent, but who would own up to that and tell the truth and say, I might need a bit of help here, rather than people who would wing it and then try to cover up or deny it ever happened or something of that nature. Okay, so I would suggest to you all that the real reason we've had so many issues over the last, well, I mean, it's millennia, but 60 years, certainly, since possibly the thalidomide scandal in the NHS and to a certain degree in social care across the United Kingdom, is because we have tended as health and social care organisations to value performance over trust. And I would hope that we can now start to reset that dial. That's just a personal opinion, and I'm perfectly open to challenge on it. But you look at all of the incidents that have occurred, either relatively a long time ago or relatively recently. Most of them, it comes down to there's been an absence of trust or truthfulness or honesty at some stage, which has obliged people to try to make up for a lack of performance with untruths, etc. That's just the way that I read it. Okay, any questions, observations there? Shall we move along? It's a really, I mean, it might be an interesting graph to show to your teams and ask them, how would they like to be promoted? If they had to recruit people, what would they be looking to recruit? Where would they be looking to move people? You get the idea? Get your people involved in this as a discussion to sort of start to tease out why this trust element is so important in our teams. Let's move along, if I may. Have any of you come across this rather fabulous book? The Ideal Team Player by Patrick Lencioni. He's the same guy that wrote 5 Dysfunctions of a Team, a book that those of you who've been on our high performance leadership training will know we're very fond of. Well, Patrick's also written this book, The Ideal Team Player. And slight spoiler alert here, I am going to slightly suggest to you there may be some elements of this that I could talk to you about in advance of you buying it or reading it. Okay, would anybody just like to have any of you read it? Doesn't seem to be nobody's putting their hand up. I don't think any of you have read it. Okay, well, first of all, I don't recommend a lot of books actually as we go along, but if you're in the business of recruitment and retention, I think this is a must read for you in terms of how we appraise people's suitability to join specific teams. Okay, I'm going to do a quick spoiler alert here. Here's the basics of Patrick's book. Okay, so Patrick says there are 3 principal elements to anybody in respect of their suitability to be joining a team, and you can see the 3 key elements there are humble, hungry, and smart. He talks about humility. I'm going to read a little piece here to you that I've just pre-prepared. Okay, he says, humility is the single greatest and most indispensable attribute of being a team player. What's amazing is that so many leaders who value teamwork will tolerate people who aren't humble. They reluctantly hire self-centered people and then justify it simply because those people have desired skills. Kind of going back to the high performance bit again. Or they see arrogant behavior in an employee and fail to confront it, often citing that person's individual contributions as an excuse. The problem, of course, is that leaders aren't considering the effect that an arrogant, self-centered person has on the overall performance of the team. This happens in sports, business, and every other kind of team venture. Isn't that extraordinary? And yet, how often, when we're recruiting people, do we ask questions during interviews and so on around humility? How often do we use a CV as the basis of their suitability for a job? And we ask questions to do with their technical competence rather than their character. And I would suggest to you, again, it's just my view, I would certainly glance at a CV and I'd take some pointers from it. But what I really want to do when I'm getting into the recruitment phase, into the recruitment phase of an interview, is to what extent are people's characters able to be discerned? And ask yourself, what do you want from people who might want to join your team? Now, Patrick puts this ideal team player right at the center of this Venn diagram, okay? And it's interesting because if it was me actually with Patrick, I might draw it slightly differently. I might make some of these things a bit bigger than others. So I might actually make humility a little bit bigger. Julie, go on, you've got a question for me.
Yeah, I was just very interested to hear you talk about, you're exactly right. I recognised I've been in interviews where, I've been the interviewer, and I guess, yes, we are looking at technical competence. And in terms of that character piece, I'm just wondering how, in the NHS, I feel that we are driven in terms of our HR processes and the fact that our questions have to be, driven by what's in the job description of the person. But how do we move to an interview process where we can go on that gut instinct, as opposed to just having to put a score against the technical competence? Because you're right.
Yeah.
When we submit all the interview summary forms, you're expected to have tested the technical competence against the job description of the persons, but there's little there for gut instinct and character. This is, maybe others have on this call have got a different experience, and I'll be interested in hearing it. But I do feel a bit restricted in the role that I'm in to go by that gut instinct.
You're on mute, John.
Mute?
Oh, sorry. How have I done that? I'm not on mute. Can you not hear me?
now.
I stunned you with my comment. We can hear you.
You can. Oh, excellent. Gosh.
Yes.
Okay. So sorry, Lisa had put an interesting comment in the chat to do with how do we measure humility. I think we can actually. I'm gonna do a little reveal on that in a moment or two, Lisa, particularly at a recruitment interview. Claire, you've got your hand up. Would you like to ask a question or make your point?
Yeah, I think from my perspective, I've done an awful lot of recruitment the last 12 months. And I think it's very difficult because you kind of told that you can't score people on their character or their personality. So your questions always have to be, measurable in terms of, do they say the right keywords? Do they have this outcome? Do they describe this? So it's very difficult in an interview to be able to ask them a question that you can then effectively score. So what I've tried to do is offer scenario-based questions.
Perfect. So we're going to come on to those, a few of those in just a moment or two, to illustrate this point. But I'm with you. Last week I was with a group of dental students in Swansea, and they're going through interviews to get their next placement for their second or third year a specialist training activity, and the interviews that they're undertaking are all completely process driven, where the interviewer is waiting for keywords to be used so they can literally put a tick in a box. I just think we've lost the plot if that's the way that we're actually going about recruiting people, when we are in desperate need of good people who have got good character. Alexa, you've got your hand up. Yes, go ahead.
I think this is a very interesting topic, actually. And going back to what Julie said, I was just curious whether we could do more of a value interview on values, as like we have trust values, we have NHS values. I was wondering if we could do more of that. I'm also on the GMTS scheme as well, and one of the core themes that we have is the compassionate leadership. And so I feel like this is something I'd like to do in my own leadership journey, is when I'm interviewing people, perhaps I will try and ask, maybe do the scenarios that was mentioned just a minute ago as well, but maybe try and see if their values, the candidates' values, align with ours and our teams and our hospital values. I wonder if that's the way we can do it. I don't know. I'd love to hear your thoughts though.
Well, my thoughts are really, as I've already kind of outlined, there may be other people on the call here, but you know, I mean, the big question when Claire says we're told that we can't recruit on values, the big question, of course, is, well, who is telling us this? You know, because it doesn't make any sense. If it was your own organization, your own business, with your own investment in it, there's no way that you'd ignore people's character and values and so on. You just wouldn't. Why would anybody recruit without referring to that kind of stuff? So I don't know how we've got ourselves into this situation, particularly the NHS, but I'm absolutely determined to find a way to dig ourselves out of it. It's interesting. I just thought, just give you a bit of fun here. What do you think happens if we find people who are humble and hungry, but not necessarily smart? What do we get there? Patrick Lencioni says we get the accidental mess maker. So in this bit here, if we hire people who are hungry and smart, but not necessarily humble, we get the skillful politician. So that's a combination here. And if we hire people who are humble and smart, but not necessarily hungry and desiring of success, we get the lovable slacker. I just thought I'd share that with you before we go any further. Just, it was interesting that Lisa was asking about how do we manage humility and so on. Well, got some ideas here from Patrick's book, if I may. So if you wanted to measure humility during an interview process, it's kind of as Alexi was alluding to a moment or two ago. You could ask a question like, tell me about the most important accomplishments of your career, and then listen for the words like we rather than I. You get the idea? Just in terms of humility. Or what was the most embarrassing moment in your career, or the biggest failure? And look for whether the candidate celebrates that embarrassment or is mortified by it. Humble people generally aren't afraid to tell their unflattering stories because they're comfortable with being imperfect. You get the idea? So it's very much creating these scenario-based questions where you're asking people to answer them, and by answering them, they're divulging the extent to which they are humble, hungry, smart, etc. I could go on with some others. I mean, hungry, what's the hardest you ever worked on something in your life? Look for specific examples of real but joyful sacrifice. For smart, you could say, how would you describe your personality? Look for how accurately the person describes what you're observing and how introspective they are. Get the idea? So there's ways around. We don't have time to go through this in the most monumental detail today, but I do think it's interesting. For any of these things, actually, you can start to measure them during an interview process. And actually, at times like appraisals and so on, you can ask open-ended questions of people so you can determine the extent to which they're any of one of those three characteristics. Shall we move along a little bit? Because I want to talk to you. Well, go on. What do I want to talk to you about next? Yes, Rachel.
You wouldn't be benchmarking by any chance, would it?
Benchmark, thank goodness. I think I was going to have to kind of have the picture of the bench up forever and a day, okay? You want practical examples, I would guess, most of you. around, okay, so how do you assess the extent to which your workforce planning is accurate and effective and successful? So one of the things I would suggest is we need to be able to, as leaders of people, be able to put our own honesty hats on tight and even tie them on under our chins, so that even if we're trying to get rid of them, those honesty hats remain on. The first thing I think we need to be able to do is figure out, okay, lots of people in your organization, be it health or social care, are going to be interested to the extent to which their remuneration is fair and equitable versus either other departments or other employers in their area or other employment opportunities that they may have. I appreciate within the NHS, within the health service, this tends to be directed by local equivalents, and it tends to be directed in nursing by bands or by contracts, that kind of stuff. I do understand that. But doing a little local analysis of what sort of payment is going on elsewhere in the area and what can you do about creating a more equitable environment in your organization is never a wasted effort. I can tell you, Professor David Loughton, who's just stepped down as Chief Executive of Royal Wolverhampton, he used to do this really regularly, looking at other major employers in the Wolverhampton city area and figuring out what does Wolverhampton need to do in order to still be able to attract the right caliber of people to come along. You're unlikely to win that, by the way, in terms of being able to offer top dollar. But if you're not aware of the competitive pressures that your people are being subjected to, could even be in the family home, as your spouse gets home, talks about their day, talks about the fact they've just had a pay rise or something like that. If you're not aware of what the benchmarking opportunities are elsewhere in your local area, I would suggest that you look to rectify that fairly rapidly. Okay. The second thing that you might want to have a think about, because as I say, in the NHS and social care, we're unlikely to win any local competition in respect of pay rates, but you might want to look at benefits. So what benefits can you offer as an employer that might make, even if you can't pay the kind of competitive going rate in the local area, what can you provide by way of benefits that might offset against that lack of pay? And certainly, I mean, the NHS pension, for example, is a huge part of that. But think about holiday entitlement. Think about things like creches and access to childcare. We are in an environment where that really matters to people, and quite rightly. Think about flexible hours. Think about working from home opportunities. Think about how do you make it desirable for people to want to come and work in your organization or team, rather than take the bigger money that might ostensibly be available elsewhere. And you might be thinking to yourself, there's very little that you personally can do about that within your particular NHS team. Well, I might beg to differ there. I might say to yourself, what's some of the really small stuff that you could do within your team that would make people feel valued, respected, acknowledged, and rewarded? Even if it's not big money stuff, what could you do that would make them feel good about their working week or something of that nature? Does that make sense? I'm just trying to, chuck some ideas and suggestions out there that you might find useful. Okay. The next thing that you might want to do is do a little benchmark exercise in respect of how are you being viewed, both in your, if it's the NHS, been your big NHS trust, how's your department viewed? How are you viewed personally? What's your reputation? And does that need a little bit of work? Or how, in the case of social care, how is your provision of services viewed locally from a competitive perspective? Do you have a good reputation for quality, for looking after people, for doing the right thing by the staff that you employ? Or perhaps not necessarily due to a fault that you've got, but maybe a predecessor has had, actually your local reputation is poor, and maybe that needs a little bit of work. But the only way we can find that out again is by ramming that honesty hat really tightly on our head and asking questions of people and encouraging them to give you an absolutely honest, straightforward, from the heart answer. Yeah? One of the questions you might therefore want to ask yourself, well, what do you think that might be then? Now we've just been through, so how are you viewed? What's the question that some of you might want to be asking yourselves? Shall I try for you? How often and how do you go about finding out the answer to that question? So, to what extent are you able to seek honest answers to the what's my image, either personally or the team's or the organization's image, either internally or locally from a service or an employment provision perspective? How often do you go out of your way to try to find out what the answer to that image question is? Do you make it easy for people to be able to give honest feedback? Or do you actually tie them in knots with all kinds of complicated processes and email addresses and registrations and so on before they feel able to actually divulge what they really think? So one of the keys is, if we're going to do this benchmarking exercise around either our personal or team or organizational image, we've got to be able to ask that question of people in a really easy to access, anonymized if necessary fashion, and we've got to be able to be seen to be doing something about the answers that we collect. I'll try to move us along a little bit here. I'm a big fan of the happiness index. How do you know how happy the people are who you have working for you? To what extent do you ask questions of them to do with their personal circumstances, or the extent to which they to which they feel inflated or deflated, the extent to which they feel inspired or uninspired, boosted or drained? How often are you having those conversations with people in an honest, open and accessible manner, such that you're able to genuinely listen to and absorb the answers that they give and then be seen to do something about it? Because the most unhappy people that I've ever worked with are the people that never have the opportunity to have a conversation with their line manager around genuinely how they feel. And I wonder, I'm open to your response to that. How often do any of you in your workplace either have that conversation with the people with whom you work, or feel able to have that conversation about the people to whom you report? Claire, what do you think?
To be honest, just this past week, this is something that's become quite important in my team. I did some leadership training, and it became quite apparent that we do not do this at all in my department. So as a result, I've developed a feedback form that we'll start doing at PDRs, but then actually will form part of a monthly one-to-one, which is around what do you think's going well, what do you think you need to improve on, and then what feedback do you have for me as a manager, and what do you need from me to be able to support that?
That sounds encouraging. And do you do that is that a form they fill in anonymously, or do they do it as a named person?
They can have a choice either. So you can meet as a one-to-one and talk through the answers with your immediate line manager, or the people can have it as an anonymous form and then submit it.
Well, that sounds very promising for you, Claire. I'm delighted that you're doing that, and it's not an easy thing to do. You've got to acknowledge that you've not been doing that, and that takes some bravery and courage to acknowledge that you've not been really addressing that. But the second thing is to put that in place in a manner in which it's completely easy and accessible for people to give that feedback in an intelligent manner. So Becky says, in supervisions, I always ask what's going well, what's not going so well. I guess the question there is, Becky, to what extent do your people feel able to answer that openly and honestly without fear of consequence? That's the biggie. I've worked for some awful people that will ask you that question, and if you dare respond with anything that might paint them in a bad light, well,
Yeah, I get that.
the
I think
ceiling
'cause
comes down.
we're very clear, open and transparent. Like I've got a focus group this week to give me all that feedback as well. So it makes a difference if it's negative or if we have to improve. It's about coming together as a team, improving it as a company. So we're quite open about our feedback, good or bad.
Yeah, and you develop a reputation
Mm-hmm.
for the extent to which, even if people give you difficult feedback, your reputation will be on the basis by which you absorb, listen, and are kind towards the people who've given you that feedback.
Yeah, absolutely.
Lovely. Okay. Somebody's just said that magic word, exit interviews. Well, guess what the final thing was on my benchmarking? It's if people leave, what do we do constructively, positively, and empathetically and compassionately to actually hear from them the genuine reasons why they've decided to go and seek their career development elsewhere? And I must say, again, I'm not being unkind, I'm not telling any untruths here. My experience within the NHS is that a lot of you do not do exit interviews in a manner that any independent observer would regard as empathetic, compassionate, open and transparent. It feels more like a kind of a process that you are obliged to go through. It's impersonal, it's tick boxy, and it doesn't really get to the root cause of why are we losing people. So again, we're all in the business of trying to be as good a leader as we possibly can be. What can you do individually to rectify that kind of process driven, rather matter-of-fact thing that really a lot of people, I know, they're obliged to do them, so they do them as quickly as and as impersonally as they possibly can. Okay, we are going to do, Jade doesn't know this yet, but as I was preparing all of these slides for today, I was thinking to myself, we've got to do a how-to session on how to do an exit interview in a really effective, empathetic, compassionate manner, so that people feel genuinely listened to when they're on their way out the door for whatever reason it might be. Because my worry is we're just awful at it at present. Or we may have pockets of excellence, but we've also got pockets of absolute misery where, obviously the difference between the two equals inconsistency of approach. Okay, so that's my benchmarking bit I wanted to chat to you all about. I wanted to return to this because I just think this is such an important precursor to everything that we subsequently discussed. Okay, and I want you to ask yourself maybe some key questions in the wake of today's workshop Power Hour. So number one thing I would suggest you ask yourself, are your values, your own personal values, and those of your team and organization that you work for, are they clear? And are they what any of your followers might regard as attractive and worthy? Or have you got no idea really what your values are or what the values of your organization are? And actually, I've got no idea, therefore, whether they are attractive and worthy because nobody even knows about them, or they're opaque. Or do you know what? Worse of all, they vary depending on the circumstances in which we find ourselves. That's the first thing you might want to do. Second question, I'd love to get all of your opinions on this. I think Lisa referred in the chat to something to do with appraisals and assessments and so on. But I would just ask you, what are you aiming to achieve from appraisals that you conduct with people? Open question. Go on. Would anybody like to answer it? What are you aiming to achieve? Go on, Lise. What do you reckon? What are you aiming to achieve?
So we have quite a structured appraisal process, and we're
I
looking
have
at
no doubt about that in the RAF, but go on. What are you aiming to achieve?
So we review performance and review potential, and then look at ways to support that potential development, etc. So yeah, those are the two aspects that we will review as part of a sort of an annual appraisal.
Just repeat the second part of the third part of that. You are looking at ways of
developing somebody to improve their potential.
That's the crunch. That's the real crunch for me. Would anybody else like to have a go at this? What are you aiming to achieve from appraisals? The silence tells me that a lot of you have never really given that question any great thought. And yet, if you think about it, if you can't answer that question, then why are you doing appraisals? I know you're probably told to, and it's kind of a part of the daily activity or half yearly or annual processes that you are obliged to follow by HR and OD. But just take the "I'm made to" out of it and ask yourself, what are you aiming to achieve from it? So somebody's just put, that was a really good one there that I've just read in the chat, sorry. So we've got make staff feel valued. I love that, Sally, thank you. I think we're kind of getting towards the right answer here. Rachel, go on, what do you think? Why do you do appraisals? Rachel, you've done it again. I'm going to start having to fine you, I'm afraid.
I know. I literally only just turned it off as well.
It's all right. Don't worry.
Turn that off in case there's feedback, and then I forgot to turn it back on. Yeah, I try to, when I'm speaking, I'm doing appraisals with the team, is try to say to them, it's a way of us getting to know each other, more informal, getting to know each other. What do you want to achieve? Where do you see yourself? How can I support you to develop? And vice versa. If there's things that they need me to do differently to help them to support or achieve things, it's like a two-way conversation for us and the department and the team to develop.
I like that. It's that support word. I think that's the key bit here. Appraisals really are there to support people. You're aiming to make them feel appreciated for the great work that they've done. And if they've got some gaps in their performance ability, how can you help them to improve upon that? That's as I see it at any rate. Would anybody else like to have one final bash? So to hear us identify there are any needs, training, etc. I like that. But again, it's back to here, if I may, it's back to this idea of how do you make people feel valued, respected, acknowledged? Yeah, it's all of those things that I think we need to go into. Number 3 then, how do you promote people? On what basis do people earn, in inverted commas, the opportunity for a promotion? And again, very few of us think through this process. So we end up with people in positions that they are manifestly not qualified for, or worse still, have never had any support to feel confident and competent to do. And yet there they are, they've now been given this new title, and they are terrified often about how they get on and actually deliver on the new expectations that their promoted position creates for them. It's just a really interesting topic, I think, about the means by which we go about promoting people. So would anybody like to answer that question just out of the blue right now? How do you promote people? I know Lisa's desperate to do this because I bet the RAF have got a process for it. But how do the rest of you do it? What drives promotion for people? Oh, Alexa's looking confused. Josh is looking confused. I've done it now. Rachel looks like she doesn't want to answer because she's probably going to put herself on mute again, and I'm going to insist on a fine. I just want you to take it away. You don't have to answer it now. Take it away and give some thought to it. So in other words, how do you know somebody is ready for promotion? But if they're not ticking all the boxes for readiness for promotion, why would you still take a chance on somebody and help them in their promoted role? It's something really fundamental, I think. So Sally says commitment, enthusiasm, common sense. There has to be something there about ability as well, I think, Sally, that they've got to feel believed in. Above all else, they've got to feel that you or somebody else above them in the chain of command really feels that they're able to do this, and you ask them, you take them through what support do they feel they might need in order to make a success of this. And that's on you as the appointee to make sure that you deliver upon it. Joshua, go on, you've got your hand up.
Yeah, so I've not had to, been the opportunity to promote anyone yet. I imagine it's going to be something like, so what drives a lot of people to want a promotion is probably going to be money or advancement in career. But then from the employer's standpoint, probably what you really want when it comes to promotion is for the people who are like grassroots developed for promotion, or if you see some like amazing, sorry if it's really noisy there, if you see some like amazing attributes in them, you know, it's one of those where the best leaders are the ones who don't want to lead. So it's probably true for managers. I think in the NHS we get a lot of people who are serial career hoppers and they work their way up really quickly, but that's not necessarily who we need. We probably need more of the people who aren't interested in management, but we encourage them because we say you're actually like an amazing natural leader. We need more people like you at the top.
Yeah, I think all of that is perfectly fair. By the way, it's not just the NHS that career hops people up the chain of command, you know. Lisa says review of potential and performance are key in the decision. Don't disagree with that at all. Julie, you've got your hand up. What would you like to offer?
I was just saying that, you know, sometimes at more senior level, and I mean at the exec type level, not necessarily at my level, I think it's more about fit for the team. And that's what you often see. It's not necessarily so much. So sometimes I see people that maybe have been recruited from external. I think, gosh, you seem quite young, or you seem like you've not had much experience. But they're looking for fit. They're looking for fit over that technical competence. It's not even about values. From my personal observation, it's not about the performance and trust piece. It's just do they fit.
It's the fit. I totally agree. There's, you know, you've got your. That's why I started this off with, are your values clear and attractive, stroke worthy? So when we're recruiting people for promotion, I just think they've got to be a fit with those values. Their character has to be something that we can all believe in, and we're all different characters. I get that, but can they fit? And you know, do you believe in their full potential or not? I think the number 4 thing there, are you as attractive as you think you are? Well, do those benchmarking exercises and genuinely find out. And don't try to fudge stuff. If you're hearing bad news or difficult to digest feedback, well, you're just going to have to take your Gaviscon and digest it. Yeah, that's the trick. We don't always hear the good stuff. Sometimes we get told uncomfortable truths. The mark of the really high-performing leader is the extent to which they're prepared to take that on and do something constructive about it. Anybody got any idea what number 5 is? What's your score out of 60? What am I referring to there?
12 conditions of success.
12 conditions of success. You can get, by the way, that score out of 60 turned into a percentage. You can do that, and you can be aiming each, you know, month, year, half year, just to be creeping that up as you keep resubmitting that exercise. That's always an interesting one to do. And then finally, what will you address tomorrow and how? What I'm trying to get you to absorb there and embrace is, all right, now we've had this discussion, now we've had this opportunity to share some ideas. What are you going to do tomorrow to actually address some of this stuff and make your work environment a better, more attractive, more compelling and effective, high-performing place for people to come to want to work in? Because the uncomfortable truth right now is all of us have the opportunity on a daily basis to improve that environment or not. It's our choice. It's the words that we use. It's the behaviors that we demonstrate. It's the behaviors that we tolerate or walk past from other colleagues and so on. That's what defines the environment in which our people are invited to participate. So I would just encourage you, go away now and do something with the information that hopefully you've been able to absorb over the last hour. We've got a couple of minutes left. Would anybody like to make an observation of any type? I'm open to ideas. Well, can I ask a straightforward question? Was that helpful and useful? Or was it, give me some feedback here. Was that okay? Jolly good. Rachel, go on. Yeah, tell me something I don't want to hear. You're on mute again. I can't believe she's on mute again.
I was just going to say, can tell I haven't had Teams meeting for about a fortnight, can you? Yeah, I was just going to say, no, it was really helpful. It's quite thought-provoking, and it's helped to look at, look internally at myself, not just at the department as a whole. So I found it really helpful. Thank you.
Good. And the difficulty for most of you on this call is you are bound by existing processes and policies and procedures that have probably been set years ago, and for some reason unknown to me are still slavishly adhered to. I think if I could offer one piece of advice, it's a request to you all, which is to really start to speak up for how can we do this in a more effective, empathetic, compassionate and inclusive manner, so that actually we are better able to recruit and retain and train appropriately the people that we have. That's the bit that I think we need to kind of start to, I'm not talking about a revolution here, but I think we are perfectly entitled to question some of the stuff that we're required to do at the moment that manifestly does not play to a modern audience and a modern society that has different needs and wants and requirements from that which may have been the case 10 or 15 years ago when some of these processes and procedures and policies were being laid down. Okay, look, we're pretty much bang on there. I'm so glad so many of you could join it. If you've enjoyed it, this is the Institute of Health and Social Care Management. If you've hated it, well, it's the NHS Confed. There you go. All right, everybody, enjoy the rest of your week. It's just been a jolly exercise this afternoon. Thanks so much for joining in. We'll repeat this, and we will do a how-to session on how to do an exit interview as well. Okay, thanks so much, everybody. Nice to see you.
Thank you. Take care, everyone. Bye.
Bye bye. Bye bye.
Thank you.